Hi everyone, my name is Noor Aburas. I am a Master Public Health student here at Wayne State, and as part of a webinar series on mental health with the Campus Health Center, today I'll be going over treating and managing anxiety. It'll be a brief overview. So just as a preface, we did have two different webinars before this one, where we talked about the introduction to anxiety, just an overview of that. And then we also went into test taking anxiety. So I do highly suggest that you watch those as well. So just like always, I'll go over a little outline of the presentation. Today I'll be talking about anxiety management strategies, signs that you might need help, resources at Wayne State, and then also some off-campus resources. So here are some anxiety management strategies that are suggested. The Mayo Clinic and the Anxiety and Depression Association of America did put together a guide where they recommended different strategies to help manage your stress and your anxiety. First one being to start a mindfulness practice and try using grounding techniques. So a good example would be to try doing some deep breathing exercises, especially when you do find yourself with high levels of anxiety and stress. Try to implement a more positive thinking perspective, especially when you find yourself having negative thoughts. That does tend to take time, but you have to catch yourself in the act. It is something that you have to put a lot of work into. Try getting enough sleep. It's recommended to get 7 to 8 hours as an undergraduate student. I did go over this in my very first webinar in the semester, where I talked about different habits to implement as a college student, one of them being getting enough sleep. So I talked about different recommendations, like how to do that, like the reason, like, the benefits of it and things of that sort. So I suggest you watch that as well. Um, they also mentioned eating a healthy, well-balanced diet. So try your best to avoid high fat and high sugar foods, and then go easy on the caffeine as well. It can be pretty difficult because we need to stay awake, and be alert so that we can, study and get the most out of our studying. But try your best to go easy on the caffeine. And then build a support system. You want to make sure that you have somebody to talk to, as we all do. Sometimes we rant and things like that. And just the idea that we have somebody that we can go to is really nice, and it'll help a lot. And then creating an independent study routine that also tends to benefit students. And then the last one being to download specific apps that can help. I have one that has been highly recommended. It'll help to relieve that stress and anxiety. It was ranked the #1 health and performance app, which to help people calm down and focus through breathing exercises and different classes, which would help with your symptoms of anxiety. So here's some signs that you may need help. If you find yourself going into isolation from family, friends, classmates, just people around you in general, and then having, just withdrawing from your social life, that's one sign. There's the frequent worry that interferes with your daily life on a long-term basis. There's irrational fears and then avoidance of harmless objects, places, and situations. You have recurring nightmares, flashbacks, or numbing of past trauma. There's having emotional outbursts, and then there's a whole list of physical signs as well. Keep in mind, we're saying if you've experienced these in the long term, then that is a sign that you might need help from a professional. So some examples are muscle tension, fatigue and sleepiness, shortness of breath, difficulty swallowing, sweating, and more. So this I felt was very important for us to go over, getting that help that you need at Wayne State on campus. So I have a few resources that I think would be crucial to you as a student if you do find yourself having a lot of issues with anxiety, managing it to be specific. First one being, of course, the Campus Health Center. We do offer a variety of mental health services. So we do have confidential and free mental health triage, which can also help you get connected to different resources. We have counseling, we have therapy. They can help you manage your psychiatric medications if necessary, if that's what's been recommended to you from a professional. And then more connections to on and off campus resources. We also have the Counseling and Psychological Services called CAPS, which a lot of students are aware of. They also provide a variety of different services. So we have, for currently registered Wayne State students, you can get yourself an initial consultation with a counselor. They'll help to determine the best place to address a student's needs. There's individual counseling, crisis intervention, group therapy, and a lot more. And then for the campus community in general, we do have they do have workshops, educational activities, consultation, and then also outreach services and events. So they do have one service that's called Let's Talk that helps a lot. It's casual, confidential, and cost-free. So you can always reach out to them and ask for more details, but it is a drop-in consultation. And then there also is this one specific workshop that they've been having this semester specifically on Mondays. It's for people that are living with anxiety. So I would suggest you also try joining that if you'd like. And the very last resource that I wanted to stress today is the Mental Health and Wellness Clinic. So that's over at the College of Education. The services offered include individual mental health counseling and psychotherapy for children, adolescents, and adults. Then there's the couples counseling if you need it, family counseling, group counseling, and a much longer list of that. As mentioned before, here is an exhaustive list of all the resources on campus that can help you with any of your mental health needs. You can feel free to pause and take a screenshot. Some national mental health resources, as I mentioned before as well. I highly suggest that you use these resources to read up a little bit more. And then keep in mind, if you are having a mental health emergency, make sure to call the Wayne State Police if you're on campus, or dial 911 if you are off campus. You can also go to the nearest hospital emergency room. You also have the 988, which is the National Suicide and Crisis Lifeline. And then they have a crisis text line as well to reach a crisis counselor. And then, of course, as always, Campus Health Center does have a social worker on staff that can help you with counseling. So go ahead and call or go online to schedule an appointment. Here is our contact information if you do want to get in contact with us, as well as the references that I used for today's presentation. And then just a preface as well, the next webinar will be the very last webinar within the series on mental health. We'll be going over winter blues and final stress. Thank you.